Hello and welcome to the Wise Women Wednesdays. My name is Jennifer Regular and I am the Soul Illuminator at Lighting the Path. I'm also the host of this show and I just love bringing women from all around the world, from all walks of life, who have a journey, a story, and a message from the mess to share to help you become who you came here to be and do what you came here to do. And today my guest is Dr. Peggy Gleason. She is a Duke-trained certified integrated health coach with several other certifications as a life and wellness coach and holds a doctoral degree in natural health. She has been a nurse for over 4 decades and specialized in critical care nursing for 30 years. Her passion is to coach nurses with burnout by exploring all dimensions of their lives physically and emotionally. She has inspired women from all over the globe, too, to continue their success as professional women while finding time for living a life of more contentment, better health, and more peace of mind. Peggy is originally from New York and currently lives in North Carolina, where she's joining me today. And she lives there with her husband, and her greatest joys come from spending time with her children and grandchildren. Dr. Peggy Gleason, I'm so excited to have you here today, and I'd love to hear how you rose and help others rise from the ashes of burnout. So welcome.
Thank you so much, Jennifer. I appreciate that generous introduction. And the question I think you're asking is, how did I get here, right?
Yes. What lit
You're
your
talking
path?
about burnout, right?
Mm-hmm.
And, when I look back at my own career, as you heard, was pretty lengthy, to say the least. I when I look at my whole career nursing, and I always worked in a big medical center in New York, and I ran one of the biggest neonatal units up there as well. And I loved my work, loved my patients, loved the families, loved everything. But I also wanted the heaviest patients, the people with more machines and lines. I just thought that was where I thrived, And I was doing that. I was a single mom for part of the time. I had aging parents, and it wasn't just work that I was feeling the crunch from. And the reason I'm saying that is because burnout comes from many directions. For me, I, was doing all those things, getting up really early. I would even go to the gym first and then go to work and be there at 6 o'clock because I thought I could. I believed I could do everything. And I think that's what happens with women. I think we're just invincible, and we have our little cape on, and we're just going to go out there like superwomen, and we can do everything. And I was doing all that while simultaneously, of course, taking care of everything at home. Like I said, aging parents, and I was actually studying for my doctoral degree during that time as well. So you can imagine the term burning the candle at both ends.
Yes.
Really had a tremendous meaning, right? Because I was doing that. But the interesting thing is, I wasn't even aware that I was burning out. I didn't even know. And it wasn't till I realized I did have some physical things going on. I had unrelenting, crippling migraines every single day. I never missed a day of work, never. But they were really bad, and I was getting some GI issues. And it wasn't until I realized having a standing appointment with your neurologist is not normal. That is not okay. Something's wrong here. Mm-hmm. And it wasn't until I really had to step back and really look at what I was doing in my life. I was doing too much. And the reality that I had to accept that, no, it's okay not to do everything. So I, going to school and becoming a coach, I got all the tools. I started using the tools, and I've never looked back. And I want to be able to offer other nurses the same thing I was able to achieve.
Yes. I remember a quote too by David Allen that says, "You can do anything, but you can't do everything." And it's really humbling to really learn to accept that, to be open to multiple possibilities. And like you say, have the cape on and ready to do anything, but then recognizing too that we can't do everything because physically our bodies can't. And our nervous system's not equipped to deal with it. And sometimes the burnout happens too when we start to lose passion for our work. But there's burnout in, many different areas in life, even for women and others who are at home parenting and not out in the workforce. But then there's burnout that comes about from any type of work that's really demanding, or we carry a lot of responsibility, or that takes a lot from us. What I find with nurses and caregivers, and I had a career in social services, human services for over 20 years, that there's also compassion fatigue. Dr. Peggy Gleason, can you explain some of the differences between burnout and compassion fatigue?
I think, it's really interesting, and I'm glad you brought that up because people do get that confused. Well, is it compassion fatigue or is it burnout?
Mm-hmm.
The bottom line is compassion fatigue is a very big part of burnout. But compassion fatigue, when I look at it, I look at how, and you had just mentioned it, it's losing your passion. It's sort of like when people have compassion, thinking about nurses particularly, your heart is bleeding for people. You just feel so darn bad for them. You just want to fix them. You want to make them better. And it's a constant, right, in that kind of work. And I'm sure it was constant in your work as well. That's what we're here for, to serve. But when you start losing that desire or that intensity, you're sort of becoming disengaged with, I just can't do it anymore. I can't really make myself care this much anymore because I'm burning out. And I think that's part of it. That's the big difference. And I look at burnout, like I say, it's all part of burnout. Some people, I honestly think pretty much all burnout contains a component of compassion fatigue,
Sure.
Especially in service-oriented professions. But burnout, when I look at it, it's not just physical, it's not just emotional, it's every single part of a person's life.
Yes.
And when I work with them, I look at 12 dimensions of wellness, 12 dimensions of wellness, but there's also 8 wellness areas. So I look at all of the components and say, okay, what's going on in each area? Because chances are it's coming from a lot of directions. You're getting pounded between your social wellness, your relationships, and your physical being, and your occupational wellness, which of course is the cause. There's so many areas, right? And I think that's the key. And for people to realize it's not just one thing or one other thing. It's many, many things that hit you all at one time. And that's why you get burned out, literally.
Yes. I think that's so important to recognize as well, because when we're pulled in so many different directions, we can become very scattered, very fragmented, kind of lose our sense of self. And I love how you're talking about integrative wellness and how there's these different dimensions to look at wellness. And also, we're multidimensional beings. We have needs on the emotional, physical, spiritual, mental levels that we need to support ourselves in. And when we're so focused on everything else or everyone else, then we really begin to lose that. So you mentioned how your body got quite affected and was impacted by the work you were doing. So how did you recover from that?
Well, the first thing was to recognize it, notice it, and accept it. And until you really do that, there's no way to work on it, because you don't know what you don't know, right?
Right.
So it's really taking stock, stepping away, getting some help. That I think everybody needs support if they're suffering from burnout. It's not a one-man show. You definitely need support and guidance getting through to the other side of burnout. For me, it was, as I said, acknowledging and taking the steps to, number one, find time for myself. Because
Yes.
when we're burned out, we don't think we have time. But the fact is, we do. We do. And I know that most nurses, I go, but you do have time. They will almost get angry and say, what are you, crazy? I don't have time. I don't have time to go to the bathroom. I mean, they get really pretty comical about it. And I get that because I was there, I was in it. But once you get the guidance and somebody say, okay, let's help you learn to find the time. And it's going to be through many different ways that you will find the time. And that's one of the things I teach first is let me help you find the time.
Yes, because it is there. We just need to discover it and see it to believe it, really, right? Finding the time, giving some room to breathe, taking a break. Yeah,
because the thing is, once you realize you do, once we go through the whole process and figure out what's the most important thing for you to tackle today, we, of course, with all coaching, you do have to do the assessment and find out the outstanding thing that's going to help you to tackle that burnout. Once you realize that, then you're going to realize, okay, you need to find the time. And part of that is prioritizing. How important is it for you to get through this burnout, to start healing? And yeah, if it's that important, we're going to find the time. There's no doubt about it. You will find the time and you'll be amazed at where your time really is going, because that's the unique thing is we do have more time than we think we do,
Yeah.
And that's all part of what I work with people to realize.
Yeah, and setting those priorities. And you said one of the priorities became making time for your life to enjoy.
Exactly.
And I know your children and your grandchildren are a huge part of that. And it's looking at those things, what we value, what we want to prioritize, where we want to be spending our time and directing our energy to, and how that lines up with our values. We're so used to being in action all the time that we don't take the time for reflection and really setting space and time for the things that are really meaningful and supportive for us and what's most nourishing and productive, and being able to take that higher path that can really support us but tune us into the life that we want to be living and how to show up for that. True, right?
Absolutely. And there's so many small changes people can make that don't take a lot of time. I mean, when I went to Duke, we were taught first thing, 5-minute meditation. 5 minutes, that's all you needed. That's all you needed to start. And then you develop more and more skill sets to help you get to the next area. But sometimes it's just 5 minutes that you need to realize you got to use it wisely for you, whether it's closing your eyes, whether it's a breathing technique, whether it's sitting and journaling. I have a routine every day. Get up, of course I have to have my coffee, but that's my little addiction is my coffee in the morning. But to sit quietly, close my eyes, meditate, then journal. And that sets me up for my whole day. And that's just a simple, it doesn't take a long time. I mean, it depends on how I want to meditate that particular day, but that's what sets me up for the day. Yes. And it becomes part of your day is just, I have to sit quietly, meditate, and then journal. And that's it.
It's true, Peggy. And it doesn't have to be something so different that we need to learn or incorporate into the day. It could be something that's already part of your routine, like having that morning coffee. Yeah. And just doing it so mindfully, being really present with sitting down to have it, the aroma, the ritual of making it, especially if you have some fancy way of doing it, like a French press or something, just setting that up, or even lighting a candle or having some flowers around, like where you sit to have it. Or just, you can make it a sensory experience of holding the cup and feeling its warmth, or if you're into iced coffee these days, having that, but just, seeing what it feels like, what it tastes like, how it smells and just how you feel when you drink the coffee. And I like there was someone who did a meditation called Fill Your Cup, and whatever your beverage might be, um, just imagining that you're filling your cup. Let's say you're filling coffee as caffeine, but we can also fill it with joy, with
Yes.
contentment, with peace, with whatever it is you want to be experiencing, and filling that in your cup. And as you sip it, you're sipping that joy,
Mm-hmm.
that peace, that
Mm-hmm.
contentment. So, like you say, it doesn't have to take long, and it doesn't even have to be something really different that you have to add to your day. You can add so much to your day when you're more mindful and present with it, and time just opens up. I mean, we think
That is
relaxing is going
very
to take
true.
away,
That is very true.
and it's the opposite. Yeah, it's having
And
this.
it's also the same with journaling. And now I'm a real supporter of journaling. I think it's one of the key things that I teach all of my clients.
Mm,
And the one thing I tell them is get a nice, beautiful book. I want you to feel the book. I want it to have texture. I don't want it to be a speckled, school thing. I mean, it can be, sure, whatever you want to do, but honor your journal. Honor those are your precious thoughts.
mhm.
That is a really, really important book. And I know I love my journals. I always have a really nice one. I always have one ready to go when I finish one. And I think just holding on to that journal and realizing it's sacred. It's sacred because it's
Yes.
your thoughts.
Hmm.
It's from head to hand to paper. And I should say heart to hand to paper. And I think that's a really another part of being mindfulness with journaling is get a special pen. Make that, a special practice and revere it for what it is.
It reminds me too, it could be the etymology and the indigenous teaching around sacrifice, that it originally meant to make sacred.
Mm-hmm.
And if we can sacrifice that 5 minutes, that time, to make a sacred ritual, then it's
Right.
really worth the investment, isn't it? Well, what do you say,
Absolutely.
Peggy, to people who are legitimately feeling the burnout? I mean, they're in the depth of that burnout and they don't have energy to even write or pull up a journal or to, make themselves a cup of coffee. Well, what can they do?
That's a great question because when you're in burnout, you're definitely not thinking about being mindful or
Hmm.
thinking about the cup that your coffee's in. You're sort of between being on the grab and go diet, which is really the basic dietary diet for nurses. You grab, go, and
Yeah.
that's it. You just
Hmm.
grab, shove it down your mouth, and then you go. And that's the
Hmm.
way they live, especially when they're working bedside. I think the first thing they should do is, if they are having a problem, is seek some help. Seek a person who does understand what they're going through, someone that can guide them to what might be best for them. It may be coaching, it may be a program, it may be another support system, because we have to know what's right for that person, because everybody's suffering in a different way. But that would be my first recommendation, is really find support, someone who will listen to and respect what you're feeling. And, get the support you need to heal from it too.
Thank you for that. Yeah, and to recognize that there are options, there are
Oh, there are
opportunities.
so many options. Absolutely.
And what do people get or can expect when they work with you?
Well, I love working with people. So they can expect that it's going to be lighthearted much of the time. We're going to be smiling a lot because it's a very sad topic. And what they're going to experience is, yes, you're going to have your highs and lows, but you're going to get a lot of hope and you're going to discover things you didn't realize you were capable of. We do look at all dimensions. I spend quite a lot of time really digging to see exactly what's manifesting. What do you need first? That's where we go first. We go where you need to go. You'll get 1,000% support from me when you work with me. I also have other, not just coaching, but I have individual coaching, group coaching. I have courses and, support in that respect as well. Plenty of resources for sure. But you can expect to have somebody that's going to hold your hand the whole way and get you to the gates and look at burnout behind you.
Oh, it is so reassuring to know that you're there for people in that way and can hold space for them to heal and to grow and to rediscover themselves again or who they are now too, right?
Absolutely. It is a wonderful feeling to witness my clients have an aha moment, right? They'll go, aha, like I never thought of that, because there's so many of those when you're healing. There's so many things that right now are buried underneath the rubble of this horrible dilemma of burnout, which has so many layers. And we have to kind of lift one layer at a time. And that's what we'll do.
Amazing. And I know that you wanted to share a gift too with the audience and whoever's
I
listening.
really would love to share this gift because it's one of my favorite.
Tell
And
us
the
about it.
reason I'm sharing it is because it's a really cool workbook. And when you open it up, you're going to say, well, what is this? You're going to go to you're going to get a link and it's going to take you to this pretty sign up page. And it will deliver to you this workbook, which will help you to identify where you are in each of the 8 areas of wellness.
Oh.
And you're going to find out for yourself, how are you doing financially? How are you doing with your job? How are you doing with your relationships, your physical being, your emotional being? And it's going to go on and on. And I think that's such a great place to start for anybody, no matter whether you're going on to the next program that can lead to. I usually use that workbook for my 8 Steps to Wellness online retreat. That's my favorite program that I like to do. I like to work with women on that. That's like the best, because you're going to work with all those 8 areas, and then you're going to take a journey. You're going to get your passport. You're going to take a journey, and you'll get all this information each week, and you'll get coached on it, and it's just glorious.
Wow, that sounds incredible and such a generous gift. So thank you so much for that. And we're going to leave a link for that in the show notes, as well as how people can connect with you. So what's the best way?
The best way for them to connect with me is there is a very short video clip. It's only about 55 seconds. And on that is a link that you can click on that, and it goes directly to my calendar, and you can set up an appointment for a quick Zoom session just to get some information or ask me questions or whatever it is that your needs are. So I do have that there in the giveaway.
Oh, perfect. Great. So I'll have
But
the link
I
to
will
that.
also, in case people don't catch, because it's on the screen, the link, I will send an extra copy of just that link, because sometimes people go through the video. I know I do. And they go, oh, wait a minute, it was on the screen. I have to hurry up and write it down. Wait, I missed it. So I so respect that, because I've been in that situation where it's like, it's on the screen. Wait a minute, I need it physically. So I will send a separate link for that as well.
Awesome. That's perfect. Thank you so much. And is there anything else, any other final words of wisdom that you'd like to share with the audience today?
I think when it comes to nurse burnout, and for any of the viewers here, whether it's nurse, I mean, I work with all caregivers. I don't work with just nurses. I work with all caregivers that are suffering from burnout. That's number one. But I would say, just know, number one, you will get through it. And number two, you are so worth it, and you are so loved.
Well, thank you so much. Yeah, I really felt that. You will get through it. Dr. Peggy Gleason, it has been so wonderful having you here and sharing your time and your energy and your wisdom with us today, and your own story that you've been there, done that too. And and now you're sharing that gift with others, that gift of wellness, the gift of recovery, and getting down to what's really important so that, you're spending time doing the things you really want to be doing.
Absolutely. Absolutely. I want to give you my sincere thanks for having me as a guest on your podcast, Jennifer. I feel honored to be here and honored for anybody who's watching. I'm grateful for you watching, and I'm wishing everyone wellness for sure.
Absolutely. Yes. Thank you so much. I'll second that. Thank you all for listening and watching today on Wise Women Wednesdays. I honor you and hope to see you again. Thank you. Bye for now.